I'd like to introduce Dr Francesca Worsman, who is an internal medicine specialist from Avenel Equine Hospital. She is originally from Scotland and has worked in the UK, the US, New Zealand before arriving into Australia. Her harness racing highlights over the past decade include being the senior racecourse vet at harness races in Scotland, as well as working with standardbred foals in studs in New Zealand. Her particular interests are in neonatal critical care and cardiology, and she has a postgraduate degree from a study into the equine athletic heart. Francesca is a wealth of knowledge and she's wonderful to deal with, so really appreciate her time in putting together this talk for us this evening, and I think you'll find it really insightful. Thanks.
So hello everyone, and thank you very much to Kath for having me here. It's a fantastic turnout and I'm really enjoying the evening so far. So when Kath spoke to me, we're obviously talking about what's really relevant at this time of year, and I think it's really important to talk about neonatal sepsis. So we've already had quite a few cases through the hospital, so I'm just going to give you an overview and hopefully you'll come away from this with more of an insight into what goes on and how we manage these foals. So, as I said, my name is Francesca. I am from Avenel Equine Hospital, which is just down the road. I have been there, but obviously prior to being in Australia, have been all over the place. So, home for me is Aberdeenshire in Scotland. We've got an image there in the top left in the summer. To be honest, that temperature there was probably comparable to the temperature here today. I'm very much enjoying the Australian winter. You can see the Scottish winter there with the snow around Edinburgh with those Exmoor ponies looking over the view of the city of Edinburgh. As Kath mentioned, I have actually worked in a variety of other places as well, including Kentucky and working with standardbred foals there. And also working around New Zealand, so in the Waikato on the North Island, but also more recently around the north of the North Island and working with some standardbred studs there. And it's great to see the standardbred turnout from studs today. So I'm obviously going to talk about foals and neonatal sepsis, but I have to sneak this in. A real passion of mine is equine cardiology. And there is a wealth of knowledge coming out at the moment with research groups in the veterinary field in cardiology, particularly with standardbreds. And there's a lot of new and very exciting techniques that we have to offer, particularly for treatment of athletic racing standardbreds. So there's some pictures of when I was the senior racecourse vet at a harness racing meeting at Musselburgh in Edinburgh. And that video in the centre there, it's showing a horse which is being converted from atrial fibrillation and arrhythmia, which these standardbreds can have racing, and we've converted it under electrocardioversion rather than giving them a toxic substance, quinidine, which can convert them to, and this is a new and exciting technique that hopefully we'll see more on offer in Victoria, in Australia. So back to this time of year, I'm going to talk about neonatal sepsis. So first of all, I don't know how many of you are familiar with sepsis, either that be that sepsis in people or sepsis in animals such as horses and particularly foals is what we're going to talk about. So sepsis has been recognised for a really long period of time. It first really was actually probably reported back in 700 BC. The ancient Greeks referred to sepsis, and what they found is that they were starting to recognise that people were getting ill and that they were having infections which were rapidly spiraling out of control and leading to death. So sepsis itself, described by the ancient Greeks, is pertaining to decay or to rot. And so they were very aware that it was a serious infection with a serious risk of death. More recently, and by more recently I mean the 1800s, Louis Pasteur recognized that there were a proportion of people he was treating with a nasty lung infection, pleuropneumonia, that were becoming generally unwell and dying quickly. And really that's probably the most recent reports in modern medicine, be it in the 1800s, of sepsis. So if we think just about horses, we know that these signs that were reported in people, of people getting infections and then rapidly progressing to become more ill and sick, People first reported inducing sepsis and the signs associated that they found in humans in horses from the 60s. And they were able to do that by giving horses particular bacterial toxins, so LPS toxins from bacteria to horses, which would cause these signs in healthy horses, and they rapidly became unwell. So sepsis is very much recognized, as I've mentioned, but it has different manifestations. And so humans with sepsis might present differently to foals with sepsis, and foals with sepsis might present differently to adult horses. So we're going to focus on talking about foals today. And in terms of these different manifestations of sepsis, for the human medicine world, they've actually created consensus definitions of the different presentations of sepsis, and the most recent one was in 2016. So sepsis, by definition, is the life-threatening organ dysfunction by a dysregulated patient or host response to infection. And unfortunately, a more serious progression is sepsis shock. So septic shock is sepsis with circulatory and cellular or metabolic abnormalities profound enough to substantially increase the risk of death. So in terms of why a foal might become septic, it's generally based on the fact that they will have had an interaction with bacteria or bacterial products in their bloodstream with their innate immune response. And it's their innate immune response in response to the bacteria or the bacterial products such as toxins. But we know it's not just limited to bacteria, which shouldn't be there. Viruses can also result in sepsis, and NMS as well. So NMS is an abbreviation that I will use through this presentation for dummy foal syndrome. If you guys are familiar with dummy foals, I don't know if you've had many dummy foals, but I'll just use NMS as neonatal maladjustment syndrome interchangeably with dummy foals. So we know that there's an association with sepsis in response to those. So in terms of how a foal might present with signs of sepsis, we know that it's not necessarily going to be the same as an adult horse. And we know there are certain findings that we can look for to help us score the degree of risk of a foal presenting with sepsis. So there's been different scoring systems over the years to help vets predict whether a foal has sepsis and also the potential risk of death associated with certain findings. So one thing that is very much common to foals and humans is that early diagnosis and treatment of sepsis improves the outcome. So we know there are certain risk factors associated with a foal likely having sepsis. And so this is really critical for how we're monitoring the brood mares and the foals. So if we know that the mare has a history of placentitis, so maybe the mare's been found during pregnancy to be dripping milk, there's been some investigation, you've called your vet, you've got them out and they're concerned that there's been inflammation or infection with the placenta, we know that that potentially is going to increase the risk of the foal when it's being born of having sepsis. We know that also not just limited to placentitis, so infection or inflammation of the placenta, but just maternal illness during pregnancy can also be associated with an increased risk of sepsis for the foal following birth. So some examples of maternal illnesses might be diarrhea, pneumonia, and so if we know that that has happened to the mare during pregnancy, and if you had concerns after foaling that the foal just wasn't doing right, then that would be a case of saying, right, well, you know, we're concerned about potential sepsis here, and calling the vet and determining more and getting more information about how best to manage the foal. We also know that with prolonged mare travel during gestation, there can be an increased risk of the foal having sepsis. Dystocia or difficult foaling, again, can be associated with the foal having sepsis after birth. And then both prematurity, so obviously the foal being born early, or dysmaturity, the foal being born at term, but looking not ready, so looking premature, are also associated with a risk, as is premature placental separation, dummy foal syndrome, as I've mentioned. And what we very much know is associated with sepsis is failure of passive transfer of immunity. Now, what I mean by that, I'm sure you're all quite familiar, is obviously when the foal's born, as soon as they're born, within 2 hours, we hope that they should be up and nursing, and that will be normal behavior. And that's really important because when they're nursing, they're getting passive transfer of immunoglobulins, antibodies, into their system, which is going to help their immune system defend themselves. So it's really important that they manage to get that colostrum into them and that they have a successful passive transfer. Now, also, obviously, that colostrum, if it gets into them, it's got to be good quality. So they could have failure of passive transfer, even if they're nursing enough, but the colostrum is very poor, or the mare has lost colostrum prior to foaling. So it's really important that they have successful passive transfer, and if they don't, then that's something that we need to be reactive for, and we can give them plasma transfusions. So in terms of determining whether a foal has had a successful transfer of these immunoglobulins, that's where it comes into the importance of taking a blood sample after foaling of the foal, 12 hours to a day after foaling, to check their IgG levels, which I'm sure you're all really familiar with, and make sure they're above a level that they should be to confirm that they've got enough immunoglobulins. So lastly on that list, there's a few other things, but lastly on that list, umbilical neglect can also be associated with sepsis. So if the foal's obviously in an environment where there's an increased risk of bacteria, the foal could be at increased risk of getting sepsis if that umbilicus is exposed, not drying properly, or not being managed with a disinfectant or an umbilical dip. And that could increase the risk of sepsis by transfer of bacteria through the umbilicus as well. So just here on the slide, we've got a foal just showing signs that this is a dummy foal, which was also septic, and only from a few weeks ago, which is just not nursing and not on the suck. So very much an example of a foal at risk. So in terms of you calling us as your vets and saying that you've got concerns over this foal and it's not doing right, and how might we gauge the risk of whether it needs more treatment, what veterinary attention it might need, just like humans, if there's any concern over sepsis, rapid identification is really critical, and it's really important for outcome and prognosis. So generally for vets, in terms of identifying foals that might be at risk of sepsis or have sepsis, the first thing is generally just going to be based on general clinical findings. So foals that are born, neonatal foals, either within the first day or first few days of life, that are lethargic, so they're not getting up as often as we would expect, they're not as bright, they're not as active or interactive, they're not nursing as they should be, they have a high heart rate or a high respiratory rate. So how that might manifest without you listening to them, well, you might see them sort of puffing and breathing abnormally, their gum color might not be right, taking their temperature, it might be higher than it should be or lower than it should be. And some of these septic foals can have what we call fibrin deposits in their eyes, so the eyes can have this sort of yellow or green haze, and they can have discoloration. And sort of the most severe presentation might be foals that are actually seizuring not long after birth or in the first few days of birth due to systemic compromise. And obviously some dummy foals can present like this as well. So then for us further to identify or try and confirm sepsis, and obviously wanting to manage the foal as best we can, we actually have criteria that can help guide us, which we can determine whether they're abnormal or normal. So for looking at foals and assessing how clinically well or unwell they're doing, we, as I've said, we'll have a look at their temperature, we'll have a look at their heart rate and their respiratory rate. So these are all clinical exam findings, just things that we can do coming out onto the farm or the property straight away to check. And then we can also do a bit more. So if we take a blood sample, we can have a look at their white blood cell count and see whether that's normal or not. We can look at something that's called SAA, so that's an inflammatory marker. That's serum amyloid A, and we know in septic foals that can be higher than it should be. It can also be higher than it should be in septic, non-septic sick foals as well, though. And then we can also look at lactate, which gives us an indication of how well that foal is perfusing itself. And why that's important is because sepsis is associated with this sort of innate immune response to bacteria or toxins, and if they have marked signs of inflammation, it can affect their perfusion. And the lactate value is something that we can check in relation to that. And then we'd also want to check their blood glucose as well. So some of these foals might have a lower blood glucose than they should do, or a higher blood glucose. So over the last quite a few years now, vets have developed scoring systems to be able to try and determine if a foal is septic and what the prognosis might be, depending on some of the initial values that we can determine from the foals. And so most recently, just a few years ago, there's a recent modified sepsis scoring system, and that has a sensitivity of 85%, which is helpful for us to be able to justify saying we need to get this foal into a hospital, or this is the treatment that we would recommend. Now, in terms of confirming sepsis, and this would be sepsis secondary to bacterial infection, blood culture by far would be the most definitive way to confirm sepsis. So with these foals, I'll go on to talk about the initial investigation and treatment, but typically with these foals that come into the hospital, and we've had a few recently, one of the first things we'll do is take a blood culture. So a sterile blood culture as we're putting the catheter into the foal, and we'll then we'll have to wait 2 days to get a result, but if we have a positive culture from that blood, it's giving us evidence that there's bacteria in the bloodstream which shouldn't be there, and that's also going to guide our antibiotic treatment. Now, the caveat that comes with us is that unfortunately blood cultures in foals have poor sensitivity. So up to foals which have negative cultures, so we don't culture any bacteria from their blood, that they can have 40% false negatives. So 40% of those are foals where we don't culture anything, but actually it doesn't mean that they're not septic, and they could have bacteria in their bloodstream which shouldn't be there. So just focusing on what the vets do and why the vets do it, I just brought this example of this recent sepsis scoring system from a paper from a few years ago, and it's quite useful. Unfortunately, I think probably with that projector you're not going to be able to read it, but what it's just showing is what I've described. So they're linking a score in that table on the right side with the values that we might find from the foal. So they're linking a high score of 4 to foals which have a neutrophil count of less than 1,000 cells per microliter. So basically foals which have a really low neutrophil count, which is a type of white blood cell, they're giving a high score to. And as that table progresses, there are different clinical parameters that as vets we can check fairly readily, but there are also history findings, so knowing whether the mare had placentitis or if the foal has signs of a joint infection. They're linked to a score which then we can total up and determine the risk or likelihood of sepsis. And so that's really useful for us, for giving you information and helping you make an informed decision on what's the best approach for management and care. Now, they also included in that paper the fact that there will be some overlap with non-septic but sick foals who will have a high septic score. So as vets, we've got to bear that in mind as well. And then, just going back to these key parameters that we check initially looking at the foals, especially if they're unwell and coming straight into a hospital, which can help us gauge the risk of sepsis. So the blood glucose, the blood lactate, the white blood cell count, the respiratory rate of the foal, the heart rate, and the temperature. What is interesting, and the last thing I'll just talk about this slide, is the bacteria that are involved in these foals that are septic. So that seems to, from what's been reported, have changed over the years. We know that initially the types of bacteria, which I'll call gram-positive or gram-positive cocci, which you can let go over your head if that's a bit too much jargon. So now we're seeing more gram-negative bacteria, which are found in the bloodstream of foals, which shouldn't be there, and that's essentially what the foal's immune system is responding to and causing the signs of sepsis. So knowing that information is really useful for vets, because that's also going to help us guide our antimicrobial or antibiotic treatment. And obviously that's very much guided by positive blood culture results if we get them. So I just thought I'd add this in because some of you may or may not be familiar, but actually in terms of the initial treatment and management approach, it's pretty similar. So we're going to go on to talk about how we initially manage and treat sepsis in the foals. And I've got the Surviving Sepsis Campaign information, which is the guidelines for management of sepsis and septic shock in humans. So this is most recently sort of an update for guidelines from 2021. Before I talk about it, you'll notice there's a sofa in the top right corner. So I'm talking about us scoring the foals as vets, which we can do fairly readily with as long as we have that information to hand. So in humans, they do something similar. And the most sort of recent up-to-date thing that they do is a LQ SOFA score. So what that means is they look at some parameters to determine whether someone has sepsis. And depending on if they're getting a score of over 2, there's a likelihood that they do. So if you were unwell and going into hospital, the doctor might LQ SOFA score you. So the SOFA itself stands for Sequential Organ Failure Assessment. So they're assessing how your body is responding, and they're doing that by looking at some blood results and some clinical parameters. Now, they've updated that by putting an LQ in front of it because they also look at your blood lactate, so that's what the L stands for, and they put the Q in because they want to do it really quickly, and they want to manage you as quickly as they can to try and give you the best chance of survival. So in humans, they do the LQ SOFA score. In foals, we've got some nice scoring systems, and the most recent one that I just showed you. So in terms of you having an LQ SOFA score of above 2, and applying a human, or sort of looking at a human like how we look at foals, in humans they now have a 1-hour critical bundle that's really important for management of people with sepsis. And I've put these slides in, I know I'm supposed to be talking about foals, because the initial response and the bundle is actually really similar to what we do in foals in the hospital. So again, apologies, the writing's pretty small there, so you probably can't read it, but what they have is point 1 is that they measure the lactate of people, and we do that straight away when the foal comes into the hospital as well. As I've said, we'll take a blood sample really quickly, and from that we can rapidly assess the blood lactate, the blood glucose, but we can also get that blood sample. We've taken it in a sterile fashion, so we put it in a blood culture bottle to try and see what we can grow from the foal's blood, see if we can try and find that bacteria that shouldn't be there, which is causing this problem. So they'll check the lactate, they'll then take a blood culture sample just like we do, and then their next step is administering broad-spectrum antibiotics. So with these septic foals coming into the hospital, if we're concerned about sepsis, we'll start them on intravenous antibiotics straight away. And again, it's really because the sooner you identify the signs of sepsis and the quicker you respond, the better the outcome. So the antimicrobials, the antibiotics we're giving are generally broad spectrum, so there's a variety of bacteria that they should be able to cover, and we give them by an intravenous route, and that's as well to make sure that we have appropriate uptake in the body to try and manage this infection. So the next thing that they do in humans in this bundle of 5 steps is that they begin a rapid administration of IV fluids, and that's just exactly what we do as well. And to be honest, the fluid rates that they give adult humans are not that dissimilar to what we give to foals. And then the next thing they do is sometimes they'll consider vasopressor therapy. Now, we obviously consider this in foals as well. I have to say at this stage, I can't say to you that we give all the foals that come in with the concerns over sepsis vasopressors straight away. It will depend on some other clinical findings. So we're generally checking the blood pressure on these foals as well. So we put a little tail cuff on their tail, and we can link it up to a machine which works really quickly and gives us an indicator of their blood pressure. And depending on the other clinical findings too, it may be that we also give the foals some vasopressor therapy, which I'll go on to talk about. Just briefly at the end of this slide, I'm just going to mention the fact that in human medicine, they adapt those criteria slightly for children. So the other 2 boxes, which you can see there, but undoubtedly cannot read the writing, they're more careful with their fluid boluses, and they're also careful with how children respond to that. And they also monitor whether they need respiratory support as well. So it's very much a considered approach, but the whole takeaway message from this is that that initial 1 hour septic bundle of how best to manage a human as a doctor if they're concerned that they have sepsis is really not that dissimilar to what we do with foals coming into the hospital straight away. So I'll move on to talk about treatment now. And as I said, if you have concerns, or we as vets have concerns that a foal has sepsis, it's very much an emergency, and we'd want to treat them as an emergency patient. So these foals will require hospitalization, and that's because the treatment approach is very much intensive. So the first thing they generally do is come straight into the hospital. As soon as they arrive, we place them on intravenous oxygen. Now, I've just said there that foals are different to adults, and in terms of having a case coming in as an emergency for sepsis, we've got certain criteria, as I said, the scoring systems, which can really help us with foals, but adults can have different manifestations. So the treatment for foals that I'll talk about is not necessarily how we would treat adult horses if we had concerns over systemic inflammation. So with foals, they'll come straight in, we'll put them on intranasal oxygen straight away while we're initially triaging them and examining them. The intranasal oxygen is really important for a number of different reasons, but essentially foals with sepsis, as I've said, there's a concern that their innate immune response is not normal, and they're responding to something which could result in some circulatory compromise and compromise of oxygenation to their tissues, their organs. So they'll be started on intranasal oxygen straight away. As I've said, not dissimilar to that human bundle, we'll start them with intravenous fluid therapy. So very quickly after arriving, we'll take a blood sample, we'll have an intravenous catheter placed, and we'll start bolusing with them with some fluids. Now, typically, depending on the foal, obviously standard bred foals, 50 kilo foals, they might have 1 litre or 2 litres or even potentially 3 litres of a balanced electrolyte fluid while they're initially being assessed and managed, and while we're waiting for some diagnostic results. So we start them with the fluids, and then, as I've said, broad spectrum antimicrobials, and these are given by an intravenous route, and so this is started very quickly. We do assess some blood parameters to determine what antimicrobials we can use. We want to use ones which are broad spectrum, but there are some which could have potential side effects on some of the organs, such as the kidneys, which may guide or steer our type that we use, but fundamentally it's always going to be an antibacterial or antimicrobial, or antibiotic that has a broad spectrum of action. Typically, these foals might benefit from some plasma, particularly if they fit the history of being dull, lethargic, not nursing. They're likely to have not had successful passive transfer of immunoglobulins, so the plasma will help correct that. It's also beneficial for other factors if their foal's body is responding, the immune system's responding abnormally in response to infection. Now, glucose. So these foals can present with glucose dysregulation. Also, if they're not up, they're not nursing, we need to address their energy balance. So typically, not only will they be receiving intravenous fluids, potentially in these initial fluid boluses, and then maintained on a constant rate infusion of fluids initially, and also they'll be maintained on a constant rate of fluids with glucose as well. Some may have glucose dysregulation, so depending on how their blood glucose is coping, and if they're supplemented with glucose, we may supplement them with other medications such as insulin as well, if they need further support for their glucose regulation. These foals generally will also potentially receive a gastroprotectant, so sucralfate. We know that there's an increased risk of potential mucosal disease with these guys, so sucralfate is often indicated for treatment. And as I mentioned earlier, it may be that pressors are a fairly standard part of the human bundle approach. Pressors can be very much indicated in foals as well. We have different type of pressors that we can give them, like humans. So if we have a foal that's got really poor blood pressure and signs of poor circulation, we'd want to give them some circulatory support. So we can do that by giving them an infusion of dobutamine. Sometimes we use some other vasopressors depending on how they respond to that, such as noradrenaline. and argipressin or vasopressin as well. But fundamentally, as I've said, it's an emergency, and if they require all these different types of treatments, the umbrella that keeps it all together is a really strong band of nurses. So intensive nursing managing these foals. Some of them will be recumbent, they won't be able to get up, they'll be flat, they'll need support in terms of maintaining them in a sternal bed. This foal's obviously standing, but it was on a sternal bed. They'll need to be cleaned, managed, bedded regularly. If they are able to tolerate feeds, potentially fed, but if they not able to feed from the mare, then they'll have a feeding tube placed, like you can see. So very much they need intensive nursing. So as you can see with all these treatment options, if a foal is presenting flat and with signs consistent with sepsis, then your vet's likely going to recommend this emergency treatment, which is very much indicated to be done at a hospital. So unfortunately, there are risks of complications from sepsis, and there's quite a few, so it's not just limited to this, but I just thought I would talk about these. So if we have infection in the bloodstream, so bacterial infection, as I've said, circulating around the body, there's obviously a risk that could then decide to localize at a specific point, like a body cavity, such as a joint, or it could decide to sequester in the lungs. So how this would manifest would be that during treatment, or sort of after that initial treatment where we manage to stabilize the foal with sepsis, that they may then be at risk of having pneumonia, so infection of the lungs, umbilical infection, septic joints, as I've said, they could have one or multiple joints affected, and they're also at risk of having infection of the gastrointestinal tract and diarrhea as a consequence of that. Now, with the concern that sepsis results in this sort of inflammatory response of the body's innate immune response, causing poor circulation and what we describe as hypoperfusion, so that circulation is not supporting the tissue organs appropriately. The kidneys are fairly delicate organs, and we can see sometimes that unfortunately their kidneys can fail in some of these cases as well. And then just going back to this circulation, and with their circulatory response not being appropriate, that can then lead to further compromise and respiratory compromise, and most severe, respiratory arrest. So there's potential complications there, unfortunately, associated with sepsis. So we're coming to the end now. And really what I'm just going to talk about it is prognosis. So I think it's obviously very much appreciate and understand that if they sound as sick as what I'm saying, what's the outcome going to be for them, and what is it worth doing? And if it's potentially going to include all this in treatment, then there's most likely going to be a considerable investment with that. So what I can say is that some of these foals will benefit from treatment for sepsis for only a few days, and we can turn them around, and depending on the management at home, it might be that they can be further managed at home. But unfortunately, some foals will take longer, and obviously that unfortunately gets more costly. So fundamentally, the most important thing is that early treatment is key. Over the last 30 years, survival rates for foals with sepsis have significantly improved. We know that the odds of survival are far greater now in the 2000s than they were in the 1980s. So they're over 3 times greater odds of survival for these foals. And that also helps us support and justify why why we'd like to do or offer what we can. One of the most recent papers, this goes back to 2006, so not that recent, that reported 50% survival rate of foals which were hospitalized and treated for sepsis. And in comparison to foals that were hospitalized because they were sick but they weren't septic, then the survival rates were between sort of 75 and 95%. I talked about the sepsis scoring. We can look at survival scores, and those are based on admission variables. So we can hopefully get some information which can help us to determine, based on how the foal presented to us in the hospital, how their survival might be. And so with those survival scores, foals that had scores of over 4, I won't go into further detail, but I'll just give you a number so you have it. But they were predicted to survive with a 91% what we call positive predictive value, and that's PPE. So we've got information to try and make the most informed decision and hopefully guide what's appropriate treatment and likely outcomes. So I think this is the last slide here. So if we go back to the very beginning, how can we reduce the risk? So what's fundamentally really important is close monitoring of pregnancy. So if you have concerns with your broodmare during pregnancy, or she has an illness during pregnancy, close monitoring is really important. So as I said, particularly with, for example, conditions such as placentitis, the mare's dripping milk, or there's other signs which are indicating to you that there's something which is not quite right, having that early intervention by calling the vet out and having further examination and evaluation is really useful in terms of trying to support the pregnancy, but also being aware that there is some red flags and that there might be higher risk when the foal is out. Early treatment of the placental infections is really important. When the foal is out, as I said, it goes back to that take-home message of ensuring that there's successful transfer of immunoglobulins. So the foal is up and nursing and getting that colostrum, and that you're able to confirm that they've had it and it's been appropriate by doing an IgG in that first day or second day of life. And if there is failure of the IgG, then working out how's best to treat that, and generally a plasma transfusion and then rechecking the IgG so you know that the foal's got an appropriate intake of immunoglobulins, obviously via venous transfusion rather than nursing by mouth. That's really important too. So then dealing with the foal, even if you have managed to tick all those boxes, if you've got any concerns with the foal, if it's flat or it slows down, then rapidly identifying that. So close monitoring the foal in the first few days to weeks of life is really important. And if there are any concerns, seeking that advice from your vet, even if it's just a phone call to begin with, is going to help us work out the best way to respond to that. And likely, if there are any concerns, that initial examination as soon as possible is really key, because then that's going to allow us to provide really rapid treatment. So that is me for this session. As I said, thank you very much to Kath for having me here, and hopefully that was informative and interesting.
Francesca, there we go. Thank you. Good on you. Well done. Thank you. Thank you, Francesca. Fantastic presentation.